Yeah, I think we in healthcare, I think from a technology standpoint, we are ourselves to blame. While we continue to rely heavily on old legacy systems that were doing a good job in terms of managing healthcare information, or both on the legacy,
Mm-hmm.
which was mainframe, as well as trying to generate uh, latest technology in terms of patient care. So two spectrums, both legacy core systems as well as on the patient experience side. So we brought in legislation. We wanted to make sure patient information stays with the patient. Uh, in came Epic and Cerners of the world, where the healthcare data got centralized, but it's still not operating
Mm-hmm.
seamlessly, hence the need for interoperability. Now, our problem has been from a patient perspective, it creates a fragment care experience if there's no seamless data operating. It also means repetitive information entry. Every doctor I go to, every lab I go to, I may have to enter the same information and again and again. And same with the provider offices, a physician's office and the nurse and the lab and the pharma guys, they have to enter similar information onto the system. It also means the delayed access to test results, increased risk of
Correct.
error, uh, limited engagement in care for patients. For providers, it means reduced clinical efficiency. People look for experience like Mayo Clinic, whereas what they get, where all physicians or providers can collaborate for patient treatment, whereas the data actually doesn't move as seamlessly, especially if you go from one hospital system to another hospital system, and hence the need for connectivity that would actually reduce the pain points, along with uh, the pain point that we face at the provider side is also limited care coordination. Of course, the risk of errors means fear of lawsuits, compliance gaps, frustration of burnout. A provider's office doesn't want to be spending time in entering data about the care. They want to actually care for patients, and hence the need for seamless flow of data on the provider side. Similarly, on the pharma and payer side, there are key pain points that have increased the administrative costs, that have actually missed opportunities for medication adherence, whether a patient is complying with that. We have innovations happening in the remote patient monitoring or digital therapeutics, or wearable, your iWatch being able to track your fitness and wellness and health and heart rate. But does that data reach your physician or your primary care
Mm-hmm.
provider? Uh, in most cases, the answer is no. And I believe we should be having a better connect and seamless flow of that information. Personally, for example, it took them 7 days for me to get my own audiology results to be sent from my lab to my ENT specialist to a, a, a pharmacy that was providing me the hearing aid. So it was such a
Mm-hmm.
pain point that I could see that the latest and the greatest of audiology tests, the graphs as well as everything that it provides. But from a data transfer standpoint, there is still a pain point where I can't take my mobile phone and show it to the pharmacy guys, provided uh, I need to get that
Right.
seamless experience as a patient. So, pretty close to my heart. I think it seems like will be exciting to hear how you're solving this
Mm-hmm.
problem.